So I'm a little confused. Do your patients first see a GI person, or do you do that?
It depends what needs to be done. So I don't do obviously endoscopy and colonoscopy, but again, a lot of things can be done on an outpatient basis without any interventions. So like in our clinic, we do food intolerance testing. It's a blood work, right? So if some of the patients want to do, for example, analysis of leaky gut or permeability, so we send them urine samples to the East Coast. There are a couple of labs there.
So if you find that you're gluten intolerant and you follow a gluten-free diet,
yes,
and then you supplement it with
other things, yes.
Does that help keep spondylitis in check, or are there
Well,
other?
if you have spondylitis plus gluten intolerance, then the answer is yes. But if you have spondylitis and non-gluten intolerance, the answer is no. So, and the testing for gluten intolerance is available. It's a blood and stool and saliva testing, so you don't need to go to a gastroenterologist to do it. I mean, actually, the best lab is up in Seattle. You just send a sample to the lab, and within 2 weeks you get the answer.
So can you sort of give us a profile of what it would be like to come to see you in your clinic?
Our clinic is just a rheumatology clinic. We just do things in a slightly different way. So we have a lot of patients who don't want to take medications. They want to try something different, or they want to optimize the therapy. They take medications, and they still have symptoms. So but again, it's a general rheumatology practice. I mean, we see everything. We see spondylitis, lupus, rheumatoid arthritis. I mean, it's rheumatology practice. We're just trying to combine, the best what's available in alternative world with traditional. So I do use, obviously, biologics when I have to use it. So it's my sin, but I do it, right? So we're using steroids when there are situations you don't have too many options. But again, for patients with chronic conditions, when it's not kind of an acute situation and you want to kind of improve the outcome and you have time to do it, there are options available.
And you have time to do it, okay.
Well, because let's say if you have a catastrophic disease,
yeah,
and so you're losing time, can you jump in and do something right away so you don't have much time, let's be honest.
So the biologics really are like the end choice.
You need to know the reason why using biologics. So like in my practice, I'm using biologic for very specific indications. For example, patients with uveitis who can lose the eye vision. So I do use biologic because it's a time which is very limited, right? So you miss the time, you end up with, Mike probably can comment on that. So, but you can lose your eye vision very rapidly, so there's no time to mess up with anything else. Remember that most of the supplements, they work in a very slow way. You don't expect to see miracles within 24 hours. It's not going to happen. With steroids, with biologic, you see results much, much faster. And then when the acute phase is over and there's time for maintenance, then it's time to do other things. So it's a common sense.
Thank you.
So I'm not denying that, we're using Western drugs. Yes, we do use Western drugs, but there's a room for everything.
Is it possible to get a copy of the...
It'll be posted on our website.
Yeah, it'll be both. We have a YouTube channel,
Oh.
YouTube/IFSmed, and then the slides will be up on our website as well.
These cards are on the table too, by the way. It has that information on there, right?
So questions?
The doctor told me once, over 30 years ago, when I had trouble with something else, to write down every ingredient, even on the box that I ate that day, and then see what the results were, and find out what was...
Well, you're talking about traditional elimination diet, right? So you want to put together, how different foods affect you. And so that's the right thing to do, so you can speed it up by doing the blood test. So, but if you want to go through a long route, you can do it. Like in the past, for example, in the 50s, the diet, which called a rice and turkey diet, was invented for patients with psoriasis. And it does work. It takes like 3 or 4 months to start introducing new products. I mean, if you're willing to spend a year, you can do it. So the blood work can speed it up tremendously. But the approach is absolutely appropriate. So it's elimination diet. Yes.
So what type of blood work? So the question is, which blood work do you want
For the diet?
to know about for leaky gut syndrome?
Well, if you want specifically for leaky gut, again, there is a lab on the East Coast, so they can check. It's not a blood work, actually, it's a urine test. So they supply you with a small amount of xylose, you drink it, and then you pee and you send a sample to the lab. So they do chemical analysis. If you have detectable xylose in your urine, it means you have leaky gut.
How do you spell xylose? With
XY.
XY?
And xylose is a large undigestible sugar. And if you have normal gut, it doesn't filtrate.
You mentioned psoriasis. Are there supplements or other dietary things that you can do to help minimize
The difference between AS and psoriasis is that a lot of patients with psoriasis, they do have gluten intolerance. That's the difference. And so there's a subgroup of patients with psoriasis that HLA-TQA positive, and these are the patients who benefit tremendously from gluten-free diet. Elimination diet works extremely well, much better for psoriasis than for spondilitis, honestly speaking, especially for skin lesions.
Okay, because my son has ankylosing spondylitis, but now he's got psoriasis too. So should he try eliminating gluten?
He needs to be tested for the genetic markers.
Well, he has the HLA-V27.
I'm talking about genetic markers for gluten.
Oh.